In the heart of Ndhiwa constituency in Homa Bay County, a ray of hope washed over the community as a medical camp, a beacon of health and healing, had arrived. The air was filled with the hum of activity as doctors, nurses and volunteers worked tirelessly to provide essential medical care to Ndhiwa community residents battling different types of health complications. During this year's annual camp, the pediatric care specialists focused on safeguarding the health of the youngest members of the community, where they worked tirelessly to diagnose and treat a wide range of childhood ailments, ensuring that every child received the care they deserve. The camp has also provided essential services to empower women and promote their well-being. Gynecologists, midwives, and other healthcare professionals offered consultations, screening, and family planning advice, enabling women to take control of their health and make informed decisions in the future.
I'm Benny Samuel from Medicina Hospital, and we are located at Olare in Homa Bay. Currently, we are participating in this Ndhiwa medical camp. This is organized every year. Last year, we participated. There were about 2,000 people coming for the camp last year, and we focused primarily on areas like hypertension, diabetology, cardiology, and neurology. There are many clients or patients around this place where their ailment is not diagnosed. We have seen even people with 50, 70 years old who have come in for first time diabetology or hypertension treatment, or they haven't even checked their hypertension in the last 60 years. So we were able to pick up many such cases, and that is something which needs to be addressed by the society. There are many people who lives with a lot of hypertension, diabetology and cardiology issues. So our motive of participating in this camp was to pick up those cases and provide the treatment as required, and that's what we have been doing this year also.
Last year we did the same interview with you, and then now just would you please compare the rate of patients who have tested positive of hypertension, compare last year's statistics against the ones for this year?
When we came here last year, there were about 2,000 people coming for the camp, and the people who came to our stall were about 200 plus. On the 200 plus, we were able to pick up about 120 cases, a combination of hypertension and diabetology. But however, most of the cases that we picked up, they haven't taken their ailment seriously. And out of 120 cases that we picked up, less than 20 people came in for admission. But again, we felt more than 50 of them needed admissions badly and treatment badly, but they didn't take it seriously. So we are doing a lot of counseling this year, advising people, okay, hypertension needs to be taken care and it needs to be treated. Otherwise, it is going to go into more critical ailments.
mar wang nikech arimbo apiko. Asebedo gi chandruok nikech asedhi nyaka Homa Bay katiyo gi pesa mondo mi ayud konyruok, to ayudo ka pod aonge konyruok. Koro agone Nyasaye erokamano kuom thieth manokel Ndhiwa sub-county mondo mheshimiwa manokelo thieth manokelonwa machiegni gi Ndhiwa gi dala. Agone Nyasaye erokamano, wang'a manyicha chanda ogola mayudo konyruok odiochieng' ma kawuono. Mano gima anyalo wacho, agone mana Nyasaye erokamano, kendo Nyasaye ogwedh daktari manokonya no erokamano.
Inaitwa cervical cancer.
Miluongo ni kansa mar ofuko mar nyodo.
Na cervical cancer hiyo,
Kansa mar ofuko mar nyodo ni
inasumbua watu wengi kwa sababu
ochandre ji mang'eny nikech
watu hawaendi kipimo cha mapema kuhusu hiyo cervical cancer hapa kansa kina mama.
ok dhi e osiptal mondo ginyal yudo kipimo kuom weche mag kansa mar ofuko.
Na ndio maana leo tunataka kwamba hata kama wewe hauna dalili zozote za hiyo kansa ya kina mama ama kansa yote nyingine ile, uangaliwe leo.
Emomiyo kawuono okelni ka dipo ni in gi dalili moro amora mar kansa kata kionge dalili moro amora tinyal pimi mondo ing'e.
Na sio lazima kwamba ukuwe na dalili za kansa ndio uende uangaliwe kuhusu kansa.
Ok ochuno ni nyaka ibed gi ranyisi mag kansa emomiyo nyaka pimine kansa.
Kansa mzuri ama mtu mzuri yeye huenda kuangaliwa kansa kama bado yeye ni mzima na hana dalili zote zile. Hiyo ndio kuangaliwa mzuri, ndio tupate kushughulikiwa mapema kama iko.
Kansa maber en ni ok irit nyaka ine dalili, en ni idhi adhi osiptal kata kapok ineno dalili moro amora mondo pimi mondo ifweny kata ka in gi kansa kata onge.
Sasa nataka kwamba baada ya hapa hivi akina mama na wazee kuna hiyo pale hivyo kwa ile gari hapo hivyo tutakuwa na hiyo kuangaliwa kuhusu hiyo kansa.
Wadwaro ni bang' ma joma mine kaachiel gi joma chuo chien kanyo king'iyo ng'eyi itiere kanyo kama idhi ng'iye pim mar kansa.
My name is Stephen Oyugi. I work with the National Syndemic Diseases Control Council. That is the state corporation tasked with the coordination of the HIV response in the country. I am the regional HIV coordinator overseeing Homa Bay and Migori counties. Now, today we are at Ndhiwa Primary School where we are holding the second session of Ndhiwa Be Healthy Medical Camp. This is basically community focused because it's offering medical services to the community with a huge catchment area, that is the Ndhiwa sub-county, definitely with gaps in health service delivery. Just like every other sub-county in Kenya. So this comes as a blessing because, as we all know, medical services is one of the cheap services provided in the gaps will definitely exist. As we here today, we are offering an array of health services ranging from primary health basically. We are offering testing, diagnosis, and screening, and as well as referrals. Cases that cannot be handled here are referred to higher level facilities. Now, in terms of partnership to make this a success, a number of entities are involved in this. They are numerous. I think somebody else will talk about that. But as National Syndemic Diseases Control Council, we are on board because of the syndemic diseases that are associated with particularly this area. HIV, for instance, remains a problem, even though for Homa Bay County we've managed to bring down the prevalence rates to just above 13% compared to the national levels, and comparing to where we're coming from when we had prevalences that were as high as over 20% among certain geographical areas and subpopulations. So this remains a problem, and therefore Today we are offering HIV services as one of the items in the menu that the community, the Ndhiwa sub-county community, are accessing today.
Couple present Jack, I would like to present some of our high quality powder and other assorted products, tea and every other thing. As you know, we are market leaders in the dairy business, controlling over 40% of the Kenyan dairy. So the leaders of Butcher Dairy have said what we've done today is an initiative that resonates with our contact of goodness for all. Yeah, because milk is for health and wealth. Asante sana mheshimiwa.
And that means we are
asante sana.
advancing health for all.
Asante sana, asante sana. Then finally I would like now to present to mheshimiwa maziwa ya wananchi. Yes. Amweze piga hata.
Boka wiju.
One more. Yeah, a lot of milk, as you can see, ladies and gentlemen. Just enough for all of us today. So you are drinking the best milk from the market leader in Eastern Africa, Brookside Dairy. Asante sana. Asante sana mheshimiwa.
I'm equally grateful because this fits within our theme of this year, that is advancing health for well through partnerships. Here we are partnering with Brookside to take care of our bones,
Yes.
and everything else in the milk.
Yes.
Marco.
Asante sana. Thank you. Thank you very much.
From routine checkups to specialized screening, the camp offered a wide range of medical services. Patients young and old poured in seeking relief from ailments that had plagued them for years. The camp's impact was immediate and profound.
This is the bank. The whole bank is here represented by Dr. Bennett's. And we don't have words to say. Every year, last year you gave us also, meaning they care for us. So we should also care for them. And there's something in working which I have asked you to open a branch here. And they are working on it. Thank you so much.
Families who had been unable to afford this treatment found themselves receiving top-notch healthcare. Residents who had suffered from chronic illnesses were given a chance to live healthier lives, and the community felt a renewed sense of hope and optimism.
Other objectives of National Cancer Institute of Kenya in relation to this medical camp is that we create awareness to patients out there. As we all know, cancer is one of the deadly diseases in the world, and in developed countries, actually it comes the third position after infectious disease and vascular diseases. In our country, Kenya, we are focusing on cancer because many people actually lack awareness on cancer. And as one of our mandates, when we came here on this medical camp from yesterday, we came with our team, and our team of awareness, cancer awareness, have done a good job. And we have seen from the response, we have seen high response. When we started, there was low response, but as per today, many people are willing to do the screening. The major cancer that we are concentrating on in this medical camp is we have cervical cancer, which is common in women. Then we also have breast cancer, and we have also prostate cancer. That's what we are doing here.
medical camp was more than just a place for treatment. It was a catalyst for change and growth. It brought together people from all walks of life, fostering a sense of unity and compassion. The impact of the camp extended far beyond the immediate health benefits provided. It also left a lasting legacy of hope, healing, and a community empowered to take charge of its health.
For KCI Hospital, I am happy to participate in this medical camp. I have previously participated in similar camps, medical camps that have been held here in Ndhiwa, and every time we are having medical camps, it's getting better and better. Yesterday, we saw quite a number of patients. I think even there are many than the previous camps. We saw 500 or so OPD and advised 53 patients for cataract surgeries. The interesting part is that we saw patients who were in the previous camp who came with positive results. They were happy because they had surgery the other eye, and they came back. They wanted to be done surgery on the other eye that was left. I think this time I would recommend, I would say the camp is more well prepared. A lot of mobilization was done. That can be seen from the numbers of the OPD that have turned out for the camp. And I think it was a good thing that they organized the camp for 2 days. Yeah, I would also encourage people, the community people, to have more regular checkups, especially on this issue of glaucoma, because we realize so many patients this time have the glaucoma, and glaucoma is not a very good disease because once vision is lost, you cannot recover it. I would encourage people to have regular eye checkups in order to get the disease before it gets to end stage glaucoma. Thank you.
Kana winjo kamano chunya no gik mamor kana biro notim na gimoro amora e kit kanyo mae bang'e nokona ni to nitiere gari mabiro kawo matero wafisi banda jo Nyasaye nobiro na maber kana wabiro ka chieng' jang'we manitiere wafisi notera Kisii kendo dakteche nokawo ting' maber kabisa kendo ne gitiyo makare. Ne gimaka ka gitera kar thieth mana yudo thieth maonge gimoro amora manachulo ma kendo gichak giduoga Ndhiwa kama ne gikawa. Omiyo naduoko ne giero kamano mang'eny kakoro gisani wang'a konchiel mane giloso neno kendo anyalo chako wuoth madhi kamoro. Koro gisani abiro kamano ka Nyasaye oyie ukonya konchiel nodong' nokolosi.
It's an annual medical camp, as has already been explained by the director in charge of African Health Foundation and also the vice chair and coordinator of this program. We have the main goal of not only diagnosing diseases but also preventing them. Actually, the 5 facets of healthcare, beginning with health promotion, prevention, curative, which we are doing here, palliative for those that we can't be able to help, and also rehabilitative for those that can be rehabilitated. So all the 5 facets are being taken care of in this. In Ndhiwa Be Healthy this year, we had a theme, a specific theme, which is called Health is Wealth, promoting health as wealth through partnerships. So we brought in a number of partners to be able to support us, among them the MTRH, which has already been talked about, but most of them, the MP will take you through those partners. As has already been alluded to, we have a big burden, the big disease burden in this constituency or in this sub-county. And that is why it has been realized by the Member of Parliament that if this becomes an annual event, then it can serve even as a lesson to many other sub-counties to learn that diseases are rather prevented than waiting for them. We go to the people, to the community to provide health. So that is why we are here. And this time round we are doing it 2 days so that we can cover as many as possible from the sub-county.
I am a consultant prosthetist orthotist. I am the one that is dealing with these issues of appliances, whether it is spinal orthotic. This particular appliance is called lumbar orthotic. This one here. This is the one that is in this box. And then the one we are giving the lady is a walking frame. And we have wheelchairs also that we have given out. So we have different things that we are giving out according to the ailment of the patient. So one of the things that we have given now that has brought this is this lumbar orthotic device. Lumbar orthotic device. And this one is a walking frame. And I'm also grateful to the area MP for bringing people together. As Kenyatta National Hospital, we are open to cooperation. Once contacted, we will always come and give the necessary treatment that is required. Thank you.
Thank you so much. My name is Jerry Osumba, Blood Bank in charge of Homabay County. I just have to start by appreciating the organization organizers for this kind of medical camp. It's one of the greatest we can able to show you. First and foremost, in Homabay County, we have a burden of diseases. That is sickle cell disease, malaria, among others, most of PPH to mothers who normally live. And part of our blood that we are using in the county just relies on the qualification. So our target as Homabay County for blood is around 11,400 pints in a year. We are not able to meet that gap. We are currently around 7,000 last year, but we are doing so hard so that we are able to meet our target. What I can say about another issue is about the issue of sensitization to our community to know the importance of blood donation. Maybe to some extent, some of us understand the benefit of donation, maybe to themselves, even to our patients.
Detection of disease is important, and for information is that for the reason why we detect disease early is to avoid complications. The reason why you detect hypertension is to avoid complications. The reason why you detect diabetes early, to avoid complications. The same reason why we have to detect cancer early is still again to avoid complications. And then number 2, early detection of cancer, you can actually be able to manage it and someone can go cancer free. Most cancers, if you get them by stage 2 or even early stages of 3, you can do chemotherapy, radiotherapy. Some of them can do hormone therapy. You become cancer free. Even now in Kenya, we have places that we actually can confirm that you are free from cancer. For example, hospitals like UTRH and Aga Khan have what we call PET scan. And we are also appealing if maybe we can have one in our region, because we are serving a big extension of the western region. If we can have a PET scan, so that we know, is this patient, has the patient been freed from cancer? Because PET scan can actually detect even the smallest molecule of cancer in your body. So yes, it is important to detect cancer early, and it will actually save you from financial troubles, psychological troubles, and even physical health problems.
I am very happy to be here today. My name is Phoebe Odhiambo. Most people call me Ndhiwa. And I am also the director for African Health Foundation. African Health Foundation was started about 17 years ago. My husband, who is the MP, Mr. Martin Owino, Ward Chief, and our three sons, Brian, Calvin, and David. So each one of us contribute to this African Health Foundation, and from there, we are able to help the community. And we started when we were in Boston, and we thought that it was good to bring back and to give back to our community. There we found some friends, some doctors and some nurses that helped us and joined with us, and from there we've been helping the community. So for 17 years we've been building homes for widows, we've been supporting public health initiatives, and most of all we've been taking care of people to make sure that public health, which is primary care, is taken care of. Primary care is very important so that we are not running after diseases, but we are catching them early or we are stopping them. And that is why we started African Health Foundation.
Today you are here for today maybe you can tell us why you decided to bring this particular health medical camp in this region. Are there some health indicators that has facilitated you to come to this area to give residents of Ndhiwa free medical camp?
So let me say that we started this about 7 years ago, and we've been doing with MTRH in small numbers. Last year we did it a full day, and we found out that there are so many diseases that most of the people are working with and they didn't know. So we decided that we are supposed to do it for 2 days this time to be able to capture most of the people. If you see the data, you'll find that Ndhiwa has the highest diseases. When you look at malaria, when you look at STD, when you look at child pregnancies, all those when you come together, and so many elderly have diabetes and they don't know. And we have cataracts, which you just remove one day, it's just a few hours, and the person is seeing. So what we want to do in Ndhiwa, which is supported by our MP, is to make sure that we are able to catch diseases early, one, and we are able to prevent what is preventable.
They go back to where they came from. You don't know the environmental factors and things that brought them there. They come back again with progressed conditions. So what we have done here today is what is taking people to Kenyatta National Hospital, what is taking to Moi or to KUTH. So instead we have brought those people here, the experts. And I met another mama there, he was so much in pain, but we have a pain blocker, Dr. Mahindra, One injection, she can now jump like a gazelle. And she can jump like that for 1 year. And he'll come back and give another injection. So the thing is, this is a revolutionary in health delivery system, meaning what we are practicing in Kenya is not working for Kenyans. Waiting for people to get sick or sicker, and then you come to treat them. Now we have come to them. Before they get too much sick, we intervene. Because one of the factors that making this area poor is sickness. When somebody is sick and it is advanced, they sell cows, they sell chicken, they sell everything. And eventually, because the person did not get into care early, he dies. And maybe he was a breadwinner. And now you have all the ripple effects. Children are not going to school. They are not eating right. Diseases now get complicated. So what we are doing is, for example, if you are having diabetes and you don't know, we test you, we advise you what to eat, what not to eat, and how to take care of yourself. We don't wait until diabetes spoils your kidney for us to buy the machine and take you to dialysis. This is the concept, and we hope this model will vibrate throughout Kenya. And we had it even in the 80s. Why we have not done it, we don't know. They are there in books. Primary health care, early detection of diseases and treating them and managing them. That is what we are talking about. And today I'm happy that all these partners have come. I want to thank them very dearly. The Homa Bay County who is hosting, and MTRH in the Eldoret, the CEO, Dr. Kim Tai, represented here by Tarus, thank you so much. We also have the Cancer Institute, they are here. We have an institute for cancer to screen, because cancer, if found in stage 1, stage 2, is treatable. The problem is we show up when it is stage 3 and 4, so you are given days. So Cancer Center CEO, Dr. Meli, represented here with by Wanyonyi, we are very grateful for them. There's a partner of this coalition. KUTRH, that is where we have a cyber knife for the advanced cancers. They are here to make sure they get it early, so you can have hours of life and productive living. Nagasaki, you saw them here. Jiggers is a neglected disease, but it's still with us. So they are here to help us. They build floors for widows or those who cannot afford, and they treat jiggers. Mediterranean is here in Homa Bay, is a private, and that is the uniqueness of this partnership. Private, all those mission and government coming together, and we call it Together We Are Stronger. They are here. Java is one of our own in Ndhiwa, having healthcare clinic here down in Kalamindi is here. So all those who need glasses, we have referred and they are giving to them. Kisii Eye have done a wonderful surgeries to correct the sights, especially cataracts. Last time we did 120 something. I think these 2 days we'll catch many more. Until somebody like a woman said, I just heard they were stealing my groundnuts, but now I can see them. That is the kind of intervention we do here. Dr. Nick, those who have been amputated, he comes, measured, and then work on prosthetic legs or arms. And we are grateful for them. And also we have Professor Nyambuga representing Maseno University, also Uzima University. They are here to take statistics. What is it that is putting Kenyans at risk? And why is there a disease burden? They will tell us the outcome. Masinde Muliro University, Professor Ngoka is here, is the one who is heading the whole thing. Also Dr. Mahindra, I've just said, now pain blocker is in one of the tent. Those with arthritis cannot walk, they are now walking. We also have Pharma Plus. Pharma Plus is watu wa dawa. Wametupatia dawa ya kutosha, and we are very grateful to them. Prothea, Equity Bank is not left out, and Lab Ally, MSF is here, NHIF. If you don't, those who did not come, tomorrow they will be here again. If you don't have a card, they are going to give you a card free or renew for you free. So please come. Don't stay at home if you don't have a card. They are there. The Luala Community Center are also here. And Brookside, you see, this is a holistic approach to health. There's a social dynamic, there is nutritional, there is biological, and there is also physiological part of it. Brookside has brought milk here. You know, milk is good for calcium and all that. So we are also having them in partnership. Coca-Cola are just late, but they are coming. So this is a multi-group whose aim is to make sure that people have a better life. And let me say this in closing. It doesn't matter whatever we do. If people are sick, we not go far. Because if they delay, they end up in tertiary care, that means that they have wasted their hours of production on farms, on other responsibilities. But if we come earlier, we help them get healthier and productive, and we can now develop. This is the concept that Ndhiwa has now, that we get these diseases early. And we had said, even if you feel nothing, come. Because there are those diseases which are silent, you don't know. Right now, the crude death rate in this constituency is so high. Somebody dies here, taken to the morgue, taken to the grave, we don't have statistics. Because diseases were just progressing and you don't know. So to the media, please, if you could educate for me, people, to seek health care, even if they don't feel sick, that will be a great help. But I thank you, the media here, Ramogi and Citizen and all, because always you are in partnership in this kind of movement and this kind of initiative. And the Wananchi who have turned up here, we are equally great because we could announce and you don't show up. Let's value health and remain productive. Lastly, to MTRH, no, Tarus, you're here. Take our deep appreciation to Dr. Kimtai, because I know when we get many cancers here, Dr. Kirwa, when we get all these people with the conditions, we refer them there, and they waive for me. You know how expensive it is. They waive free, and they bring them back. So my heart goes to Dr. Kirwa and Tarus, who is coordinating this. Thank you so much. Any question?
As the medical camp drew to a close, the memories and the positive impact it has left behind will continue to resonate for years to come. The community that was once burdened by disease, illnesses, and despair has been transformed into a place of health, hope, growth, and resilience.
Our government sub-location, Ndhiwa sub-county. And adoko yokamano ne African Foundation, kori oregi mheshimiwa Martin Peters Owino. Wadoko yokamano kumtiet magikelo Ndhiwa tiet manono. Yomongoro yudo wheelchairs, yudo yo matuo tuoche mang'eny magalagala bithiedho nono. An mana kwayo medo lamo ne Nyasaye bong' nyakalaga ni wud ruoth ka gimedore gi migawo mar African Foundation. Erokamano.